各位同仁，大家。
Thank you, everyone. I come from Northwest Women and Children's Hospital, so we have completed over 20,000 cases of HIFU adenomyosis, over 700 cases, CSP, over 170 cases. So today, I would like to share with you the application of HIFU in caesarean scar pregnancy. So in the previous speeches, CSP has been touched upon by the speakers. So caesarean scar pregnancy means the implantation of the trapped blood cells on the scar of the uterus of the previous caesarean section, which grows and develops here. So with the caesarean section rate increasing year by year, there's an upward trend in the incidence rate. So in this process, there might be some uterine rupture or bleeding, threatening the life of the patients. So the incidence rate is not well under the statistical review. So far, we do not quite know this number. So once this gestation sac is in this embryo, but when the decidua is not well nurtured and will invade the myometrium, and the bleeding may cause. So many of the research shows that it has similar pathogenesis with placenta accreta. So treatment goals are to termination of the pregnancy and eradicate the lesion and protect the life of the patients. So and reduce the complication of the patients. So so far we do not have a standardized portfolio, so there are many of the options right now available. So we should choose according to the age of the patients and the types, which types of the disease and the fertility requirements of the patients, and try to choose different solutions. And this is a treatment regime, drug conservative treatment. So the holistic drug application would not lead to a satisfactory result. So this is really seen or used. So for this is only suitable for type 1, and or the downgrading of the CSP is not satisfactory. And another one is the surgical treatment, and it's a good way to CSP. And so the cartilage is suitable for type 1 or 2. And cartilage should be performed under ultrasound or hysteroscopy monitoring. So according to the previous speeches and mentioned by the speakers, the cartilage is suitable for type 1 or type 2. But we need some pre-treatment before the operation. So the HIFU treatment or pre-operation under the ultrasound or guided by ultrasound and hysteroscopy. So surgical treatment enable us to remove the lesion and restore the uterine but crittage cannot restore the uterine. So the next CSP, if the patient recur, that the outcome will be very severe and not satisfactory. So when the conservative treatment fails, then we choose the surgical treatment. Or if the patient goes without a fertility requirement, the patient can choose the surgical treatment. Due to the time constraints, I would like to share with you our hospital's data with you in our hospital in terms of HIFU in treating caesarean scar pregnancy. So the principle of HIFU in the treatment of the caesarean scar pregnancy is that the embryo was inactivated by high-intensity focused ultrasound to make the original heart tube position disappear. And there are some indications for the selection of this treatment. So the maximum diameter of a gestational sac less than 5 centimeters, and the gestational age under 60 days, and type 1 and type 2 CSP. And for some patients with gestational sac diameter over 5 centimeters and gestational age of 60 days. And if the fetal heart rate can be seen by big ultrasound, MTX should be injected into the sac 1 day before operation, and then HIFU treatment criteria should be tried. And ultrasound positioning is very important. So the scheme of HIFU in treatment of CSP is a pre-operative ultrasound stimulation localization, an improvement of routine pre-operative examination, gynecological color Doppler ultrasound, and pelvic MRI, and complete the bowel preparation. And this is the data or the analysis of the HIFU and UAE treatment on CSP and its efficacy. So among the 157 cases, and we can say that we compare the two groups. So the case data of the patients hospitalized in our hospital due to CSP, and according to strict inclusion and exclusion criteria, and 150 patients were finally included in this study. And this is the statistics you may see in these two groups. One is HIFU group, the other one is UAE group, in terms of different indicators like the crittage operation time, bleeding during crittage, and decreased percentage of blood HCG 1 day after operation. So the two groups comparison can be seen from this table. According to this table, HIFU group performs better than UAE group in terms of operation time and bleeding. We also conducted the comparison of the post-operative complications between HIFU group and UAE group. So you can check the first abdominal pain in terms of the several symptoms: fever, nausea, vomit, pain, and numbness in the lower limbs. So we compare the scores according to the pain. So it indicates that the HIFU group performs well than UAE group, and which is quite commonly seen in UAE group. Abdominal pain, and also the time of the recovery of the first menstruation, and the days of the bleeding of vagina also with major differences. And with the two groups, you can see we have some evaluation. There are some differences of the menstruation situation and the ectopic pregnancy CSP. There shows no statistic difference. And UAE group, one case CPA, so ovarian premature failure, so probably it has something to do with UAE. So the conclusion is that the curative effect of curettage guided by HIFU combined with ultrasound is similar to that of curettage guided by UAE combined with ultrasound in the treatment of CSP. And HIFU treatment and CSP has less blood loss, fewer complications, and lower incidence of abdominal pain, and lower abdominal pain score and higher patient acceptance. So we have about 180 CSP cases, 80% type 2 CSP. So type 2 CSP data in 2016 to 2020, July, admitted in our hospital, 108 cases, and after the so HIFU group, 67 cases. So we made this comparison. As you may see from this table, the success rate between the two groups, no obvious differentiation between HIFU group and UAE group. And also the bleeding, intraoperative bleeding, and the curettage operation time, you can see HIFU group performs better than UAE group. And there are some side effects between HIFU and UAE. In terms of comparison, we can see that the low back pain and fever, you can see the UAE group number or statistics is higher than HIFU group. So according to this comparison, you can see that HIFU group's advantages in terms of treating type 2 CSP, and in terms of the time of the menstruation onset time and vaginal bleeding days. As you may see from this table, HIFU group is less than UAE group. And also the menstruation recovery time and interval, and with the intervention, whether the function of the ovarian is affected. And so HIFU groups is superior than the UAE group, and the other indicators are nearly comparable or similar. So for the type 2, HIFU treatment performs better than UAE groups, and it causes little impact in terms of psychological impact to the patients and a physical impact to the patients than UAE group. And one of the most important things for this operation is that we should conduct a follow-up observation. The HCG. And for the women with fertility requirements, we should have this close follow-up, and we would suggest the pregnancy after 6 months, and aware the woman with the risk of the pregnancy, and very effective contraceptive measures, oral pills or Mirena, to prevent the second time of the CSP. Thank you.